My name is Dr. Allan Stewart, and I am the Chief of Cardiac Surgery at HCA Florida. I am relatively new to Miami, having spent my whole professional career in Manhattan. I trained at the Columbia University Medical Center and then stayed on faculty there for about 9 years afterwards as the Chief of Aortic Surgery, and then was recruited to Mount Sinai Hospital in Manhattan, where I created more of an international presence in aortic surgery and was involved in a lot of the innovation of transcatheter valves, minimally invasive surgery, and complex surgery on the aorta. Once I've accomplished everything I could accomplish in Manhattan, I thought, well, how can I go and change the face of healthcare in a region? And thought that Miami was very well suited because there wasn't necessarily a preeminent heart center anywhere south of Atlanta, Georgia, or east of Houston, Texas, and thought, well, there's an ability to make an impact in South Florida, and thought that with the amount of folks that are immigrating down from Manhattan and also the number of expatriates out in the Caribbean, that this was an ideal place to have an impact on care of the heart.
We're back in a business minute with Lily Lopez with Dr. Allan Stewart, and this is just absolutely great having you, doctor. What an honor, a pleasure, and a privilege. And here, this beautiful bay, Miami Biscayne Bay, and we can't have a better show today. So tell me, how do you feel? And tell me a little bit of your history. I know you come from Columbia University. I mean, you're one of the top cardiovascular surgeons in the world. I mean, so young. So I know that HCA must be so proud to have you here. So welcome, and thank you so much for your valuable time.
Thank you. So I am a son of an immigrant from Scotland, and I grew up in northern New Jersey and spent my whole life in the Northeast. The furthest south I had ever traveled was Philadelphia to go to the University of Pennsylvania for my residency, and then moved back to New York to train in heart surgery at Columbia Presbyterian Medical Center. And then I stayed there for 10 years and really built my career in New York, which then I moved on to Mount Sinai, New York City, where I became the head of their international cardiology program. And then operated all over the world and built hospitals all over the world, but decided in New York City everything was sort of mature, meaning that the hospitals were all very advanced in their care. And I said, well, where am I going to make an impact? And I said, you know, I'm bored. So
I like that.
I was in my late 40s, and I said, well, I want to make an impact, and well, where can I make an impact? So I, just by chance, ended up recruited to a hospital in Miami. And after coming down for about a year, I didn't end up taking that job, but I ended up looking again and saying, well, I really love Miami, and I feel like I can make an impact here. It's a beautiful neighborhood. I mean, this is the view from my office, and the people are such a rich mix of cultures. And also absolutely. Very accessible to Latin America and the Caribbean. Absolutely. And now with the pandemic, more and more New Yorkers are moving down, so it's an even bigger mix. So I feel like it was a great move for myself and my family.
And what is a typical day for you? Typical day.
So a typical day for me is about 3 heart surgeries a day, creating administration where I am creating a practice among 3 hospitals in Miami and 2 in Broward County, to try and really advance them all and make them the top hospitals in South Florida.
Absolutely. And minimally invasive surgeries, I know you're an expert on that, and I was reading your bio, you've done over 5,000 heart surgeries. So tell me about the minimally invasive, because a lot of people don't know. I mean, we're not in healthcare, so we have no idea. My members, the majority, not in healthcare, so they love it when I bring someone, and in this case, someone like you, just to listen and to learn. So what is minimally invasive?
So minimally invasive heart surgery is a progression. Back in the 50s and 60s, we cut people's chests open and opened them up, and it was a big deal. We put a big cut down their legs so that we can take veins out of their leg, and we started to say, well, okay, we can do this and we can do it safely, but how can we evolve and how can we do it better? And there are some surgeons who are innovative and like to move the field along, and the goal is to have less pain and a shorter recovery
Right.
for patients. So we moved from this big cracking the chest open and the 3 months of getting better into tiny incisions that go between the ribs, and we can do most valve repairs without opening the sternum now, and even most coronary bypass surgeries
Right.
without this incision. And now, more exciting, is we're working with industry to prevent any incision at all and fixing people's valves through their leg without even putting them to sleep. They're going home
Imagine
the
that.
next day, and that's where we're moving in the going forward. And that's why it's so important to have